to the materia medica of musculoskeletal conditions, one of the first remedies that pops into anybody's mind to do with the musculoskeletal problems is Bryonia alba. Now, Bryonia alba belongs to the family Cucurbitaceae, and naturopaths, you would have heard of Bryonia, the Bryony, but what you use in naturopathy is usually the red Bryony, whereas in homeopathy we use the white Bryony. The white Bryony is said to be much more toxic than the red Bryony. So therefore the white Bryony is not actually used in drop doses. Yeah, I mean like in a mother tincture like you would use in the in naturopathy or herbal medicine. Alright, so the source is the white Bryony. The common name of it is the white hops or the black-berried Bryony. It belongs to the family Cucurbitaceae and the order Cucurbitales. In homeopathy, the medicine is made from the tincture of the root. The root is taken just before flowering, and that is the source for the homeopathic medicine. Now, like I mentioned before, it's the red Bryony that is used as a herbal medicine, and it's been used for a very long time. It's known to herbal medicine for a very long time. Now, it's used as an anti-rheumatic, cathartic, expectorant, and an emetic in herbal medicine. And as we go along, we'll see how we use it in homeopathy too. Now, what is the pharmacology of Bryonia? The main active principle is bryonin, which is a purgative. It's a very powerful purgative. It's said to be highly poisonous, and the cucurbitaceans are among the most bitter and acrid of all substances known to man. These have an effect on the during cell division. It affects the bryonin, affects the spindle fibers, yeah, during cell division, yeah, and therefore by not producing the right spindle fiber, the mitotic cell division is affected, and therefore it's been used as an anti-tumor substance. Okay, so they're said to have anti-tumor activity. Other than that, remember, it's a drastic purgative, so therefore it's also going to have an effect on the intestinal peristaltic movement. So it's going to enhance the peristaltic movement and cause drastic diarrhea with spasms and colic. So therefore, this is going to be a good remedy for constipation in homeopathy. Alright, okay, what about the human pathogenetic trial? This was Bryonia was first introduced by Hahnemann into the materia medica, and he used 7 males and an unknown number of female provers. There's also other pathogenetic trials done by people like Woodward, Mesger, and Pritkin, yeah, and there's also self-experimentations done by Lemke, Price, and Stowe, and we do have a rich clinical verifications for this medicine. Now, what is the main theme of Bryonia? The main theme of Bryonia is when I talk about Bryonia, what pops into everyone's mind, a homeopath's mind, is it's got this big aggravation for any type of movement, any type of motion, yeah, and they are ameliorated by just being still, ameliorated by rest. Okay, keeping that in mind, in Bryonia, we see a patient who's emotionally and mentally, bodily dried up. Okay, they've just exhausted everything. Yeah, they have a big aversion to being disturbed. They get very irritated if somebody goes and wants to talk to them. And these are the people who, you know, are all the time thinking about business, their jobs. Even when they are ill, when they have the flu, they're lying down, they might be dreaming about their jobs, what needs to be done. Yeah? Now, this dryness, this mental, emotional, bodily dryness is seen in the physical symptoms of these patients too. So there's this dry skin, dryness, yeah? Dryness of the mucous membranes. And as a result of this, one of the symptoms that you're going to see is that the patient has a great thirst for large quantities of water infrequently. Remember, we've seen arsenicum album, another remedy, homeopathic remedy, where there is a thirst, yeah? But the thirst is for small quantities or sips of water often, sips of the fluid often. Whereas in Bryonia, it's for large quantities, but at greater intervals. Yeah? So that's what Vitulkas is saying. He's saying the patients of needing Bryonia are emotionally, bodily, mentally dried up, and therefore to balance this dryness, they need great quantities of water. Right? And if we look at it symbolically, we see that the water element symbolizing the emotions is lacking or has been restricted. Now, I've spoken to you a little bit about these people thinking about business all the time. So these people are also very materialistic people. Okay, for them, money is a big thing. Possessions is a big thing. Okay, although they may have lots of possessions or lots of money, they have the delusion that, or a fear of poverty, or fear of starving. Yeah, so there's always a kind of anxiety in them about the future. All right, and their mind is all the time on this business, on how to make themselves comfortable, which in their minds they'll never achieve. Yeah, and as a result of this, they become very insecure, they become very withdrawn, and that's where comes in the symptom that they want to be left alone. They're very reserved. They come across as very reserved. They're isolated from having social connections. Yeah? Okay. Now, going on to the symptoms of the remedy. Now, as we've mentioned, they have this big aggravation from motion. Yeah? Least motion. And they'd like to be left alone, and they like to be absolutely still, or they're ameliorated by rest. This characteristic or this modality so much that in a cough, okay, Bryonia, they don't even like to cough. These are the people who might hold their chests when they're coughing. Why? Because even that little movement when they cough of their chest brings about a pain. So they try to stop as much movement as possible. And this leads to the next modality where there's an amelioration from external pressure in order to stop the movement. Another great modality of Bryonia is that they have an aggravation from heat and an amelioration from any cold applications. Yeah? Except for the stomach symptoms, where the cold applications aggravate. But generally, if you're thinking about Bryonia for musculoskeletal disorders or conditions, there's an aggravation from heat and an amelioration from cold applications. All right. Now, what are the type of conditions? We are looking at Bryonia specifically to musculoskeletal conditions. So what are the type of conditions that we can use Bryonia for? You could use Bryonia for rheumatism, joint pain, muscle pain, arthritis, gout, any inflammation of the joints or any muscular pain. And if it is inflammation of the joints, you will also find, say, stiffness and swelling. All right, and again, any one of these musculoskeletal conditions will again be ameliorated by cold applications, by rest, and by pressure. And they're going to be aggravated by motion and heat. Okay, that brings us to the end of this first Materia Medica.